What you need to know about the 2019 novel coronavirus acute respiratory disease. The 2019 novel coronavirus acute respiratory disease, or 2019 nCoV-ARD, has been terrifying the public. Here's all you need to know about the disease. It was first reported in Wuhan, China, on December 31, 2019. Experts believe the infection began in a Huanan seafood market. The first 99 patients treated in a Wuhan hospital were studied. The Jinyintan Hospital released the results recently. 49 of the 99 patients had been to the Huanan market. 47 worked there and 2 shopped there. All of the 99 patients suffered from pneumonia. 82 of them had a fever, while 81 were coughing. Others experienced shortness of breath, muscle ache, and a headache. Some had a sore throat. The first 2 patients who died were in acute respiratory distress. This means their lungs couldn't provide them with enough oxygen. They were both 60+ years old and were long-term smokers. In fact, most of the patients suffered from other diseases. Almost half had heart conditions and a few had diabetes. Their immune systems were already weak. Anyone can be infected by the novel coronavirus, but older and sick people seem more susceptible to it. Of the 99 patients, 11 have passed away. This means at least 10% die from the coronavirus. However, the sample size is still quite small. The World Health Organization recommends that people practice good hand and respiratory hygiene. Clean your hands regularly with soap and water or alcohol-based solution. Always cover your mouth and nose when you sneeze. Consult your doctor if you feel ill and avoid those who are ill. Also, avoid eating raw or undercooked animal products. For now, you shouldn't worry about your pets. There is no proof that pets can be infected by the coronavirus. At the same time, always practice good hand hygiene after touching them. They can still transfer common bacteria to you. This includes Salmonella and E. coli. You might be tempted to use the antibiotics in your closet. The doctors say you shouldn't. Antibiotics work only against bacteria. The novel coronavirus is a virus. If you are infected with it, you might be given antibiotics because of a related bacterial infection. There is currently no medicine to treat or prevent the novel coronavirus. Patients are attended to in hospitals, and research on the virus is ongoing. Some reports say that it might take a year before a cure is found. Over 8,000 people are suffering from the coronavirus worldwide. The death toll has already reached 213. The U.S. National Institutes of Health said vaccine trials could begin in 3 months. It would still take a while for the vaccine to be ready for the public. In 2003, the SARS vaccine was created in 20 months. It is possible that millions will be infected by the novel coronavirus by then. SARS infected over 8,000 people and killed 774 from 2002 to 2003. Its fatality rate was 9.6%, while the coronavirus is 2.2%. Doctors say the difference is that SARS killed their hosts so rapidly, it did not have time to spread even further. National Taiwan University entomologist Meitan Shelomi wrote about it in 2017. He said, "Evolution cannot make it less lethal so long as it can still spread."